it. We turn now to an alarming uptick in the number of measles cases.
They're already nearing the total of last year, and it's only April.
UW Health's Dr. Jeff-Pothof is with us for his weekly visit. Hi, Dr. Pothof.
Hey guys, how are you?
This is an interesting situation. This year alone, 46 measles cases in 17 states, and 8 alone this week reported in the city of Chicago. The CDC actually sent a team to Chicago to get a handle on what's going on here. What's the concern?
Well, I think the concern is that we're seeing, decreased adoption of the MMR vaccine, which is incredibly effective in preventing people from getting measles, about 97% effective. So since the year 2000, we would sometimes see measles cases. They often came on travelers who had traveled to an area of the world that measles is still common, would come back infected, and maybe a couple people would get infected because they weren't vaccinated, they didn't have immunity, but these things would kind of put her out before anything could really get going. The concern today is that we have a strong enough population of folks who are unvaccinated that when a measles case comes back, we're seeing these outbreaks that are much larger. There's more susceptible people, and it gets harder and harder for the CDC and public health agencies to contain measles from spreading either farther than kind of the initial location that person came back to.
So what is it that people can do to try to, if it's possible, to kind of reverse this trend that we're starting to see?
Yeah, so the tricky things with measles is it's extremely contagious. So if you filled, a room of 100 people and one of those people had measles, 90 additional people would come down with measles. Now the trick is that we have a vaccine that's very effective. It's the MMR. You get it once, about your first year of life, around 12 to 15 months. You get a second dose between 4 and 6 years old, about kindergarten. Very effective, 97% lifetime protection against coming down with measles. That's all we need to do. But with it being so contagious, we need a really high percent of the population vaccinated, about 95%, to prevent measles from continually passing on to finding that one person who is not immune to it.
If you didn't get the MMR vaccine as a child, can you get it as an adult?
I believe so. That's not a common question that I get, but I can't think of any reason why we wouldn't be able to give an MMR vaccine to someone who's not a child and get them caught up on that series. So certainly call your doctor, but pretty sure that would be an option for anyone.
Dr. Pothof, I know that there are parents out there who are concerned about the MMR because there have been stories over decades about it possibly causing autism. I have explored this many times, looking into myself because of Geo. Is it possible to separate the MMR to have just the measles vaccine or the mumps or the rubella? Is that possible?
So at this point, no, there isn't. I think the reassuring thing is when we look at the data, it looks to be that there's correlation. When you get a vaccine, especially the MMR, it's around the same time we typically start to diagnose autism. But there have been, numerous studies looking to see if there's a causal link there. Does the vaccine actually cause autism? The answer is definitively no. MMR does not cause autism.
Are you aware of any measles cases in the Madison area?
Not officially diagnosed in the Madison area. It's possible that I'm just not aware of them. But certainly it's something we are on the lookout for. We are susceptible for measles cases here in the Dane County region, just like anywhere else in the country.
All right, Dr. Pothof, thank you so much for your time this week. We really appreciate it.